Hi, my name is JP, and I will be discussing a case study about patient JC. JC is a 6-year-old girl with spastic diplegic cerebral palsy and GMFCS level 3. She had history of left intraventricular hemorrhage, had infant PT intervention program, school-based program at 3 years old, and now transitioning to regular first grade. Patient presents with impairments such as limited range of motion, weakness on bilateral lower extremities, spasticity on lower extremities, impaired posture, and balance. This limits JC's ability to ambulate, requiring the use of reverse-facing walker and AFOs. Patient is also limited in most ADLs, such as dressing and classroom mobility. Patient is referred to outpatient PT program to address strength, mobility, and independence with ambulation. The case also follows JC's condition by age 12, where she continues to present hip and knee contractures limiting ambulation. She is being evaluated for surgical releases and to follow up with PT to improve strength and range of motion. Personal factors presents in JC's case includes her young age, normal cognition, and intelligence. This will help support her active participation and carry over with therapy sessions. Environmental factors, such as having supportive parents and grandparents, may provide benefit with her condition to promote compliance in therapy. JC also attends at a regular school, which may have limited accessibility that hinders her independence, especially with the use of an assistive device. Psychosocial factors include good emotional support from her family. Lastly, socioeconomic factor in this case is that both JC's parents work, which implies the ability to afford PT and medical expenses. However, this may also impact her participation in HEP as she's not being supervised all the time, which may slow down her progress with physical therapy. One personal bias a healthcare provider may have is the assumption that children with cerebral palsy have a limited functional progress and a decreased chance to promote independence due to the nature of its disease. The PTA can manage this bias by providing specific PT interventions based on individualized assessments and JC's unique abilities, needs, and potential progress rather than generalized assumptions from the condition. One example of a strategy to enhance JC's outcome and limit barriers is to incorporate functional activities appropriate for her age, such as adding play into her PT sessions. Include JC's interest with dolls and books to encourage her to participate, and at the same time, you can add functional tasks to improve her strength and independence. One recommendation I can make to optimize JC's safety and accessibility at school is to have a designated space for her walker and a appropriate height for the desk and chair to promote her mobility and independence inside the classroom. I will recommend United Cerebral Palsy to JC and her family. It is an organization offering affiliate programs in local community that provides support resources to patients with cerebral palsy and family members through family support groups, social recreational activities, therapy resources, legal and technological support.